they're really unpleasant for patients. They're painful, they can be malodorous, they confine patients to hospital, they have to have repeated dressings.
A surgical site infection comes obviously with the morbidity and mortality to the patient, but also in terms of increasing the hospital length of stay, it also increases the patient's risk of acquiring other hospital-acquired infections as well. There's not one thing that's going to reduce surgical site infections. So what we've looked at across the Trust is in terms of introducing a bundle of measures. So some of these are pre-operative, some are intra-operative and some are post-operative as well.
And those components of the bundle were derived from the NICE recommendations. And we also looked at the WHO global guidelines and the CDC recommendations.
I think we felt that we needed a bundle approach so that we can change everything at once and have a big impact on reducing surgical site infections. But obviously introducing the plus sutures has been part of that bundle and part of that approach to reducing surgical site infections.
Infection Control came to talk to us to ask whether or not they could start to move forwards with the care bundle and particular products within that care bundle. So I then looked at potential alternatives that were on the market. With the plus sutures, obviously there wasn't anything, so we just kind of went straight ahead.
The plus sutures are impregnated with an antiseptic, which is triclosan, which has an established safe track record. And the impregnation of the sutures with the antiseptic has a local bacteriostatic effect, and in that way reduces the risk of surgical site infection.
I think it's an obvious thing to do. I guess what we're always concerned about is the increased cost and the economic analysis in terms of introducing the plus sutures and demonstrating that the increased cost is then offset by the reducing the cost of surgical site infection.
I think that the addition of plus sutures is an independently important factor, but because it was a direct cost pressure, it might have been difficult to convince our managers, who are obviously constrained by cost, that we needed to invest in plus sutures. But the ITP did transform that argument.
Getting funding from the ITP actually made the whole process a lot easier, because of the cost pressure that was actually going to be implemented onto us because of the changeover of the products. It actually meant that the divisions could quite easily move forwards with the funding, meaning that there wasn't an actual cost pressure at all.
So I think ITP is great for a trust. It enables us to receive the additional funding and actually establish from a scientific point of view and an operational point of view as well, whether it's something as a trust that we can introduce.
Well, we actually looked through the whole of the spend data for Johnson & Johnson sutures, and we pulled out the plus sutures and worked out the difference of the uplift that would be. So the cost of the current sutures to the new plus sutures, and we then invoiced ITP and NHS England directly for that amount, and that money has now been reimbursed to us. So really quite simple.
We think now we have some solid data that we can use to maintain the momentum of this quality improvement project and to expand it into other areas, and certainly plus sutures are integral to the bundle.